Welcome to the Dentist News Network. I'm Scott Drake. Today my guest is Dr. Rob Roda with Roda and Slike Endodontics in Scottsdale, Arizona. We're discussing a recent article in USA Today which talks about how there is no adult emergency dental care in Medicaid for as many as 10 states around the country. The rest of the states have some sort of combination of benefits that's not easily explained. But what this eventually does is it forces patients that need emergency dental care to go to ERs, which ultimately is more expensive for the taxpayer. Welcome, Dr. Roda.
Thank you, Scott.
So talk about this. This is a common practice. So you find somebody in a Medicaid program. They can't really go to the dentist, but what happens is they end up going to the emergency room. They can't treat a dental problem, so they end up sending them back to the dentist, and this ends up becoming much more costly, doesn't it?
Yeah, it's a big problem. The people who are on Medicaid that have some kind of a toothache or dental problem will many times go to the emergency room because they have no coverage for going to see a dentist. The big problem is that the cost of getting treatment done in emergency rooms is much higher than getting it going to a regular dental office, and so instead of paying $70 to $100 to have a tooth extracted, the state government will pay anywhere from $250 to $2,000 or more sometimes for multiple ER visits, because the emergency room physicians are not trained in how to remove the cause of the problem. So they rely on giving people painkillers and antibiotics, but this is just a temporary solution. The pain will end up continuing, and the patient many times goes back for multiple visits to the emergency room. And the government reported that between 1.3 and 2.7% of all emergency room visits nationwide that don't result in hospital admissions are dental emergencies. So this is a big problem.
And so again, you know, when the country is in a situation where cost is always a big concern, how come nothing has been done about this? Because this seems like an obvious problem.
Well, in the last couple of years, because of the economy and the desperate need that states have had for budget cutting, the legislators in many states have decided that the Medicaid dental benefit for adults is something they could put on the table, and they removed this, for example, in my state of Arizona in 2010, and it's resulted in overall a real large increase in cost to the state because of this particular problem. And it's a classic case of being penny wise and pound foolish.
Mm-hmm. And the ADA is now looking into this and trying to get some hard numbers to see what the real effect is. So at the present time, Arizona, there are 10 other states. If you're in the Medicaid program, you have a toothache. If you don't want to pay anything, the first thing you have to do is go to the emergency room.
Right, and in fact, many of these people that are on Medicaid simply don't have the means to pay for it being done in a dental practice setting. And so the question really is, why would the government pay so much more money to have people seen in a setting where they can't get treatment versus paying a lot less for an area where they could get treatment?
Well, it looks like it's something that needs to be addressed, again, very, very quickly. Maybe the financial aspect of it, how much it is actually costing, may have an effect. Do you see some movement in that area anytime soon, especially with the ADA involved?
Yeah, the dental associations right now, as you said, are collecting information to try and get hard dollar figures as to the cost of what this practice is. And we expect here in Arizona that probably in the next year or so we'll have enough information to be able to approach the legislatures with help with defining a solution to this problem. And so it's coming, but it's going to require collecting a lot of data first to be able to really show the extent of the problem and what the cost savings will be for the states.
Well, Dr. Roda, it's always a pleasure. We appreciate your expertise in this area. Thanks for joining us again today.
Thank you, Scott.
Once again, he is Dr. Rob Roda with Roda and Slike Endodontics in Scottsdale, Arizona. I'm Scott Drake. You're watching the Dentist News Network.